Hi, my name is Dan Navarez. I'm at least 18 years old and I consent for this medical video.
Okay, so today we're going to do our medication administration video. I'm going to go ahead and we're going to start out in the med room. So I'm going to grab my MAR. So I have my MAR here and I'm in the med room. I'm going to go ahead and start off by doing some hand hygiene. Now that I have my MAR, I want to make sure that my MAR and my patient, all the information matches up. So on my MAR, I can see that my patient is Daniel Navarez and his date of birth is 5/16/1995. And according to the MAR, he has no known allergies. Perfect. Today we're going to be giving two medications. We're going to be giving digoxin and insulin, insulin Humulin. So I'm going to go ahead, get my stuff out of the Pyxis. The first medication I have is digoxin. It's digoxin 125 micrograms tablet, orally daily. So making sure that's correct. Grabbing it from the Pyxis, grabbing it from our packaging without touching. I'm going to go ahead and put it in the little medication cup. Perfect. Put that back in the Pyxis. Now I'm going to go ahead and gather the stuff up for my insulin. I have insulin Humulin R subcutaneous. It's going to be according to our sliding scale. So previously we had checked our patient's blood glucose level, which was 256. It was elevated. So according to our sliding scale, we're going to go ahead and give our patient 3 units because 256 falls between 251 and 300 of blood sugar. So then we're going to go ahead and grab 3 units of that. I'm going to go ahead, check our insulin, make sure it's not expired, grab our syringe. Alright, I'm going to go ahead and grab my syringe. I would go ahead and withdraw the 3 units of air from it. Place it down again. Grab our little alcohol wipe. I'm going to rub the top of the vial for 15 seconds. Let it dry. Now I'm going to go ahead, grab my vial, and cap my syringe. Inject the air into my vial. Flip it over. Withdraw the 3 units. Alright. Cap my syringe again, 1 swoop. Put it down. Put all my stuff back in the Pyxis. So at this point, I'm going to go ahead, just check that the dosages are correct again. My tablet of digoxin 125 micrograms tablet daily. And then my insulin 3 units of insulin Humulin. Alright, I made sure my medications weren't expired. Everything's put away. We're all set to go to the patient's room. Alright. Hello, Mr. Navarez, can I come in?
Yes.
Alright. Mr. Navarez, my name is Claudia, and as you already know, I'm your nurse for the day. Today we have some medications we're going to give you. I'm going to go ahead and we're going to administer digoxin and some insulin Humulin, okay?
Okay.
Alright, so first I'm going to go ahead and start off by doing some hand hygiene. Very important. Alright, we do our hand hygiene. So just a little bit about these medications. So the digoxin, as you probably already know, is we're using it to treat your heart failure. So your heart rate was a little high, so that's why we're gonna give you the digoxin, help with those symptoms, help lower your heart rate, okay?
Okay.
And the insulin, we checked your blood glucose and it was 256, so it's definitely elevated. So the insulin is just to get that blood sugar down, okay? Get you feeling really good. Alright, so the first one we're gonna go ahead, I'm gonna go ahead and have you verify your full name and date of birth.
My name is Dan Navarez. I was born 5/16/1995.
Perfect, and do you have any allergies that you know of?
No.
Alright, awesome. Definitely let's start with the insulin. Normally where do you take your insulin?
In my head.
Perfect. And grabbing my hand sanitizer before I start, I'm going to go ahead and lift up your shirt and inspect the site for the insulin, okay? I'm going to check your skin, what I want to see is make sure that the site, there's no bleeding, no bruising, no lesions. The skin is perfectly intact, and that's what we like to see. Because as you already know, we have to rotate sites when we're administering insulin. Let's see. Yep. So then I would go ahead, perform hand hygiene, put on my gloves. I'm gonna go ahead, grab my little alcohol wipe. I'm gonna rub the site for about 15 seconds. Make sure it's clean, at least 1 inch away from the umbilicus. Grab my stuff. Okay. Grab my syringe, pinch the skin. At a 90-degree angle, I want to insert my needle, push it all the way in, then cleanly retract. Make sure I cap it with 1 swoop. Alright, dispose of it in the sharps container safely. I'm going to go ahead and inspect the area for any irritation or any type of response, which looks great. And that's it for the insulin. Alright, so now we're going to go ahead and do the digoxin. So with the digoxin, we have to do a couple of things beforehand, okay? So first, I'm going to go ahead and check your heart rate for 1 full minute. Okay, so we're going to check the heart rate for 1 full minute. Alright, Mr. Navarez, your heart rate was 130, so which is elevated, and like I said before, that's why we're giving you the digoxin. Hopefully this will help lower that heart rate, okay? The second thing we're gonna go ahead and check is your ability to swallow. So I have a cup of water right here. Can you please just take a little drink, a little sip? Alright, do you have any trouble swallowing the water?
No.
Perfect. And then this demonstrates that our patient doesn't have any risk of aspiration. So we checked for swallow reflex, checked for the pulse, making sure that it's not less than 60, otherwise we would hold that digoxin. So at this point, just go ahead, here's your digoxin, go ahead and take it, and then if you need water, you can definitely get some water. Alright, give you a second. Sorry, we just gotta make sure you take it all. Sometimes I have patients and they're tricky and then they tell me they took it and they check and they didn't take it. So I just gotta make sure. Alright, say ah. Perfect. Alright, so my patient definitely took his pill. We don't want to leave the bedside without making sure. Alright, and that is it for me giving you medication. So I'll definitely be back to check up on you in 30 minutes. I want you to let me know in 30 minutes if you have any sign, like any visual changes, any hearing changes, like ringing in your ears, if you start feeling shaky, if you start feeling sweaty, dizzy, because those are all things we want to check with when we're administering these medications, okay? So please let me know if any of that happens. So the bed, we see it's in the lowest position. Your bed light is right here. Is there anything else I can do for you?
No, that's it.
Alright, awesome. So now that I made sure my patient's okay, perform hand hygiene, leaving the room. I'm gonna go back and chart at the nursing station. I'm gonna go ahead and initial. I'm gonna initial stating that I gave the medications already so it doesn't get confused for anyone else. And this pretty much concludes our medication administration video.